So the Health Buddy system, we work with clients such as health plans, provider groups, CMS Administration, as well as the Veterans Administration. And what we do is we sell to this client and we look at the patient population with chronic illness or serious mental illnesses. The goal there is to sell the system that includes the interface that's in the patient's home, as well as health management programs, those programs that the patient is going to be responding to, as well as a system in the background that is the provider application. It's a web-based application where the doctor has the opportunity, the nurse has the opportunity to intervene on those patients after they take their session. So the information is collected, it's patient-centric, it's about myself, and say, hey Nancy, welcome back, it's time to take your session. It's going to ask me a series of questions. Depending on how I respond to the question, it may prompt me to do something else. So if a CHF patient, for example, if I said that I am more short of breath today than I was yesterday, it's going to assess again with another question. Why are you more short of breath? Are you more short of breath at rest? And if I say yes, it's going to assess again. All of this is very helpful for that care manager that's managing that patient in the background to know relevant information when they pick up that phone to call you. The whole goal is to intervene to prevent something, an exacerbation of that disease, so the patient doesn't end up in the ER or doesn't end up somewhere in an urgent care setting. Can we prevent that from happening? Today we have about 50,000 patients connected on the Health Buddy, which is pretty amazing. Bosch is the leader in evidence-based telehealth with over 40 published studies out there. What we look at is reduction in healthcare utilization, not just ERs or readmissions, but we also look at reduction in length of stay. So if a doctor feels very comfortable about using the Health Buddy system, they can discharge you from the hospital and send you directly home because they know they're going to be connected to you and be able to monitor you. Well, the Health Buddy, actually, if you look at it, it's a very simple device. The average age of our patient population today, of those 50,000 patients, is somewhere about 70. So it has to be a simple, easy design. It's lightweight, it's less than 1.5 pounds. So individual patients can actually just wake up in the morning, touch 4 little buttons, and touching those 4 buttons, they're actually going to be responding to questions that are very simple, it's very intuitive and easy to use. You have to keep them engaged, and by doing this with the Health Buddy system, we create different health management programs, so with 360 days worth of content, not just about signs and symptoms, but about behavior, about nutrition, about exercise. You know, if you're a woman over the age of 50, the system is so intuitive that it would actually just automatically ask that woman, have you had your mammography? It would also talk about pneumonia. Have you had your pneumonia shot? Have you had your flu shots? Do you know during flu season how important it is to wash your hands and keep yourself clean? But the most important thing in healthcare today is under the Affordable Care Act, you have to take a look at how are we going to adhere to the triple aim. That's all under the Affordable Care Act. And that's better health, that's better healthcare quality, as well as reduction per patient per capita. So that is what the Health Buddy system does. It empowers an individual to become activated in their own care. And once they're activated, they become very aware of some of the signs and symptoms that could create a deterioration in their health status. Actually, the CES show is really exciting for us. To be under one roof with Bosch in a connected home is amazing. Looking at healthcare in a connected home is the wave of the future. Individuals take care of themselves at home. So having a device in the connected home that connects them to their care team, improving their quality of life, reducing the cost of healthcare, and making it more sustainable in healthcare just makes all the sense in the world for us all to be together.